Hello. In this video, I want to talk to you about X-rays. Sometimes people ask us, "Do I need X-rays? Isn't there radiation with X-rays?" And so, it's not 100% of the time. But let me describe some different things to you. When we first started our practice, we did not have an X-ray machine at all because we worked with a lot of pregnant moms, a lot of kids. We didn't want to have any of that radiation in our office. And the main reason why we got an X-ray machine, the main reason why we now have it and we take it for most people, is because early on in our practice, we did not understand how to restore the proper curves in our spine, how to improve scoliosis if a patient has scoliosis. We didn't understand how to do those things because by improving and restoring curves and restoring range of motion and improving scoliosis, you can actually help to slow down the degenerative process and slow down osteoarthritis in your spine and your joints. And so early on we weren't 100% familiar of how to do that, so it didn't make sense for us to x-ray people, evaluate if they have any scoliotic curvatures, or evaluate if they have a loss of curve in their neck or in their low back. But over the years, we actually got into learning how to do those things because I had issues in my spine, I had issues in my neck, in my upper back that I needed to address personally. And so in order for me to know how to do that, I started taking courses on learning how to improve the proper curvature, to improve if I had scoliosis or any side curvature in my spine, to improve all of those things. And I had to start taking x-rays to identify exactly where we're at. Now, that doesn't mean every single patient is going to be x-rayed. I mean, we have a lot of pregnant moms. Obviously, we're not going to be x-raying them. We have a lot of kids or infants that are in here. Now, for most of those kids and infants, we don't x-ray. Only time we would x-ray a child is if they have serious health problems and serious postural deformities. If they have those things, then we might x-ray so we can see exactly what's going on inside. If a patient comes in and they just moved here and they just had x-rays, or if they're coming from another office and they just had x-rays, then we might not have to x-ray. We might have to do one or two, or we might have to do none at all. But if a patient, it's been years or over a year since they've had an x-ray, a lot of things can change in a year's time. A lot of problems can change in a year's time. So we might look at the set of x-rays that a patient has and see what the main problem areas are. We might only address those areas as far as taking x-rays. So most of the time we do take x-rays. Sometimes we don't. One thing we tell patients every single time, no matter if you're getting x-rays here in our office, no matter if you're getting dental x-rays or if you're getting a CT scan, which that has the most radiation as far as any of the imaging goes, I would recommend eating a lot of apples before and after, and even getting into seaweed or dark green leafy vegetables. Apples are really high in a mineral called boron. That can help to repair any damage from any radiation. Again, it doesn't take away the radiation because there is the x-ray, but it can help decrease your chance of having problems from it, minimize any damage from it, and help you repair after the fact. And so I hope that helps. And again, it's not 100% that we're always taking x-rays to every single person. We do for most people. But if you have any questions about that, you can always call our office. You can email us. You can send us a message on Facebook. However you want to get in touch with us, just let us know, and I can address those things with you, and we can talk about them. But I hope that helps. Have a good day, and we'll talk to you soon.